Good morning or afternoon, and thank you all for being here. I'm Jessica Lewis, and I oversee learning and development for the Provider Data Management Department here at Molina Healthcare. Today, I will be proposing a new training strategy for remediating PDM errors. This proposal is not just a training revamp, it's a completely different approach from our norm. This new strategy represents a transformational learning approach grounded in employee feedback, evidence-based instructional design, and Molina's urgent operational needs. Early this year, we provided training on identified pain point areas, but it didn't work. How do we know? Because despite communications, microlearning, and just-in-time documentation, we're still seeing errors, and we're seeing a lot of them. This dirty data is impacting multiple downstream processes, including provider directories, claims processing, legal adherence, and of course, provider and member satisfaction and retention. I want to show you something so you can see the reality of what these errors are costing our department. I created a rework cost formula that translates the number of errors to a quantifiable cost. And I found that in rework alone, we're wasting over $700,000 a year. That's almost $750,000 just spent fixing avoidable errors, resources that could be used to support business growth, member retention, and service quality improvements. The One Big Beautiful Bill Act that went into effect earlier this year establishes new eligibility criteria for government-assisted healthcare programs. This means that individuals who previously qualified for publicly funded healthcare, they're losing their eligibility. And those who remain eligible are facing rising out-of-pocket costs and higher insurance enrollment expenses. This shift means that the population we serve is shrinking, and those who do remain eligible are going to be more sensitive than ever to the quality and reliability of their healthcare experience. So we have to deliver the highest standard of operational accuracy and service. In this environment, inaccurate provider data, it's no longer a quality issue. It's a member retention risk, a financial risk, and a Molina survival risk. This legislation makes immediate remediation in PDM performance not only important, but urgent. Error remediation training has been driven by findings from the quality assurance team and your directives and guidance on what is presented to employees. But the quality team is just looking at the end product, and you aren't in the trenches doing the day-to-day work. While well-intentioned, this top-down approach can inadvertently conflict with adult learning principles. The research tells us that adult learners disengage when they feel training is imposed on them, and that intrinsic motivation, not external pressure, is what drives effective learning that can actually impact performance. And the number of errors currently in our system proves that this leadership-directed, compliance-driven remediation we've been providing, it's not meeting the needs of our employees, and it's hurting our operational effectiveness. We need to try something different, and we need to do it now. We're proposing a more employee-centered, collaborative training model that is based on a combination of the successive approximation model, Merrill's first principles of instruction, authentic problem-based learning, and real-time feedback. Every module will follow a sequence where employees learn the concept, observe it in practice, and then perform it. Practice problems will be included that mirror actual tasks that employees face daily. Every activity will include corrective and instructive feedback, not just correct or incorrect, allowing employees to identify errors in real time, understand why they occurred, and apply the right strategies the next time around. And here's the biggest difference between what we do now and what we are proposing to do. We want employees to participate in defining the learning objectives, shaping the activities, refining the documentation, and validating and improving final artifacts. This will increase ownership, engagement, and that intrinsic motivation. The result will be a training program grounded in real work, real challenges, and real employee needs. Before the training is redesigned, we of course need to know what subject to focus on and how to redesign it. There's a number of different content areas we could focus on, but according to the rework cost calculation, Termination-related errors account for 13% of total errors found. So focusing on this first will create the largest impact on error reduction and quality improvement. To design a more effective solution, we will also need to first go back to the source, the employees themselves. We want to consult staff directly to understand what isn't working for them and use their insights to guide the redesign. During the training design, the focus will be on creating instruction and activities that are simulations of employee real-world experiences. In order to do this, it is imperative that we gather feedback from employees as we design in an iterative process until we create something they'll not only want to use, but is actually beneficial to them. To do this effectively, we'll need volunteers to assist in review and feedback, which means we'll need your help by providing incentives and time dedication from your employees. Whether those incentives are kudos points they can earn in the employee rewards program or line items they can add to their quarterly performance evaluations. Some kind of incentive is important for them to not only participate in the process, but also to give them a vested interest in the learning itself. After the training, employees must be assigned provider termination requests within the first week and continuously afterwards, so they can immediately apply what they learned and provide feedback back to us for refinement. On our end, we will house both the just-in-time documentation and the microlearning in a single, easily accessible location for ongoing support. And we will repeat this entire employee-centered collaborative process with the next highest errors found. Currently, the error is directly related to terms number 12,262. With this redesign, we expect to see an error reduction of at least 50% within the first month after training, with a continued trend towards zero in the following months. This reduction in errors and increase in accuracy won't just make our department look good. It will lower overall operational costs, reduce legal ramifications, enhance the downstream processes it affects, and strengthen member and provider experiences. By building relevance, autonomy, and meaning into this training, employees will become more motivated and confident in their work, not just for completing provider termination requests, but extending into other types of requests as well. Because they'll have involvement in the design process, they'll develop greater connections to their roles. Because they will gain practice developing training and documentation that works for them, the cyclical process of the next redesign will be accelerated. Because we will work with them to solution their needs, they'll be more inclined to reach out when they identify other areas that need to be improved, or when processes change and the training and documentation that they helped create needs to be adjusted. All of this will not only be an investment in our employees, but it will lead to a change in culture that will result in greater data accuracy and, in return, the member retention that our company so desperately needs to survive in this political climate. To ensure successful rollout, though, we need your help. We need your support in formalizing this employee-centered model. We need your approval to continue employee-involved iterative development for this. And we need ongoing collaboration in evaluating performance data and identifying future focus areas. Your backing is essential to embed this model into our operational culture and prevent ongoing data issues that threaten the Molina Healthcare business. So what do you say?